Welcome to Pearls of Wisdom. Today, we're here to discuss the topic of mental health, and specifically as it relates to dentistry. The pandemic has really exacerbated stress for so many, especially in healthcare, and dentistry is certainly no exception. One good thing that has come out of this, though, is the increased awareness of the importance of mental health and the need to provide tools and resources for people. That's why I'm especially excited to have with us today Dr. Joy Voigt-Holmes, who is a dental professional herself and someone who does trainings on this topic. You may remember Dr. Joy from a previous episode and an excellent webinar she did on diversity, equity, and inclusion. It was one of our most popular webinars then, and we have no doubt this will be too. In fact, in addition to our conversation today, Dr. Joy will be recording a webinar that dives even deeper into the topic of mental health in the field of dentistry, which will be available to all of our providers soon. She has been a great resource for us here at Delta Dental, and we hope for you too. Dr. Joy, thank you so much for joining us today.
Thank you so much.
So Dr. Joy, it's so good to see you again. That last session you did with us on diversity, equity, inclusion was one of our most popular segments, and we're really excited to delve into another topic with you today. So before we get going, I'd like to ask you to just tell our audience again a little bit about you and why you are so passionate about mental health.
Absolutely. Well, first of all, thank you again for having me. I enjoyed our conversation on diversity and looking forward to another wonderful conversation. But for the audience, my name is Dr. Joy Voigt-Holmes. I am a registered dental hygienist. I have over 25 years of experience in the dental industry currently. I own my own business, Dr. Joy RDH, where I do things such as this. I love educating. Why is mental health so important for me? Well, as an educator, I dealt with many different types of personalities, many different types of students, and I noticed an increasingly number of students suffering from mental health challenges. And I think for most of us growing up, we had this notion of what someone with mental health looked like. There's just always this vision that we have. I think social media and TV plays a part in these images that we have. And so I started to do a little bit more work because I wanted to be able to effectively respond to my students in a different manner. I also had a business partner who finally decided to share with me that she had been suffering from some mental health issues. And so I said, well, let me do some work. Clearly, what I think mental health or what a mental illness looks like is not what it really is. And so that is what really made me take a deep dive into mental health in itself. And in addition to that, I had to teach special needs to my students. And how do we treat people or different patients that are dealing with special needs? And so that is really how I got my start in this work.
Dr. Joy, for so many people, even having a discussion about mental health makes them uncomfortable. Why do people avoid having conversations about mental health?
I think there are two main reasons why people avoid the conversation. The first reason is that there's a stigma attached to mental illness and mental health. We're taught not to talk about it, but specifically in dentistry, dental hygiene, it's a very challenging career. Going through education in terms of, getting licensed and all of that is very hard. And so usually when you're complaining that you're suffering or having a hard time, the one thing that someone will tell you is, put your big girl pants on or put your big boy pants on. That's just the nature of the business. And you don't want to come across as weak or incompetent. So we tend to avoid having a lot of those conversations.
Every profession has stressors in it, and dentistry is no different. What are some of the stressors that may produce some stress, anxiety with the dentist? What are some of those stressors?
I would say specifically since the onset of COVID, and I don't want to say we're going to be living with COVID forever. So I think, but since the onset of COVID, what we dealt with is, we're at a high risk. So I think there was the stress and worry about contracting something and taking it home to our families, not having enough PPE, not having enough staff. As you know, that there are many areas where there's a shortage of workforce. But then in addition to that, what has added to those unique stressors are, am I going to get in trouble? Am I compliant? Am I not compliant? The CDC says one thing, OSHA says something else. The State Department is saying one thing, you turn on TV and Dr. Fauci may be saying something completely different. So there's always just this worry about whether or not you're going to be sued or shut down, or if a patient is going to complain. And just the very nature of the business. You go to work, sometimes you're not using the bathroom, you're not eating lunch. Once your last patient leaves, there's still all of this stress and worry about making sure you're a business owner. So are you crossing your T's and dotting your I's? And so those are very unique things to dentistry in particular, not to mention the expense of it all. So I'm just going to throw out an arbitrary number. Let's just say a box of gloves may have been $5 pre-pandemic, and now it's 25. So how are you able to pay for all of that? So very unique structure.
Yeah, those are very great points. And dentists, they've almost have like this dual scenario where they've got to make sure they take care of patients, but they also have a staff and overhead, as you mentioned, which brings an awful lot of stress as well. At the end of the day, they are small business people, most of them. Mental health is a very complicated thing, and it affects people differently. We can't look at it and say everybody's the same. Talk to us a little bit about how that impacts people differently.
One of the greatest challenges for mental health experts, so you figure it's a challenge for a mental health expert, just imagine what a challenge it is for a layperson, and I consider myself a layperson, is the complexity of it. I think people want to view mental health on a spectrum. Either you are healthy or you're ill. But the problem with that is that each mental disorder has its own spectrum. And there are over 200 classified forms of mental health illnesses. So you figure two different spectrums, and you're trying to put those 200 spectrums on one spectrum. And it's really, really difficult to do. And because of the complexity of that, and because of there's so many different types of mental health illnesses, that the chances of a misdiagnosis or a late diagnosis is really, really high.
So Dr. Joy, in the oral health space, we're always encouraging our patients to take care of their preventive care. We call it preventistry, where they go to the dentist and they get cleanings and x-rays to stay on top of their oral health. How can we be proactive with our mental health?
Two things there. The first thing is we also, in addition to taking care of our patients, we need to make sure that we're taking care of ourselves. In order for us to provide the best care for our patients, we have to be the best version of ourselves. We are in a business where we are so focused on giving to others that we forget to pour into our own cups. The second part to that is the P word. I like to call it the P word, proactive prevention. With mental health, what I found throughout my research is that the majority of the funds, about 80% of funds, are dedicated to the crisis mode. And by the time someone reaches the crisis mode, it's too late. And so if we were to take that 80% and divert that money into proactive or being preventive in nature, I think that we would see a greater trajectory. So what does that mean? That means having the conversation, specifically within the office, just amongst your staff. How was your day? Making it a safe place and a comfortable environment for your coworkers and staff to be able to share, but also having those conversations with your patients, specifically speaking to your patients, asking them, is there anything different? Doing it in a safe environment, but also helping them to understand that there is a mental dental connection, right? So people who are suffering from mental health illnesses, typically the first thing to go would be their oral health. And then on the flip side of that, someone who has poor oral health, they're missing teeth, they have really, really bad breath. Sometimes that can cause mental illness. And so I don't think people really, think about it that way. I talk a lot about dental hypersensitivity. And one of the statistics that really shocked me was that someone who is suffering from dental hypersensitivity can fall into a depression. Who would have thought that? So I think just, creating those safe spaces and making sure that it's okay to have those conversations and removing the stigma are things that I think that we can do proactively to help prevent some of these challenges.
Dr. Joy, in a lot of mental health issues, it's really a struggle to maintain balance. Can you give us advice on how some dental professionals can maintain balance in their life between their personal and their professional lives?
I think one of the ways that professionals can maintain that balance in their personal and their professional life is creating personal and professional boundaries. I think that's really, really important. I think in the industry that we're in, where we work really, really hard, we strive to do the best. I think most of us have these type A personalities, where we want to please people, please our patients, please our coworkers. And so oftentimes we're saying yes to things when we should say no, or we're putting ourselves into these uncomfortable situations. And so by creating those personal boundaries, what you're doing is creating space for the things that actually make a difference to you. You're not really paying attention to what I like to call the noise. So when you have people that are pulling and pulling and pulling, sometimes you have to say no. I like to use the analogy. I don't know if you've ever seen a possum that has had a million babies, and the possum is laying on her back, and you just have babies just nursing and sucking and pulling. And so that's what it feels like sometimes between home and work. You have people just pulling, pulling, and pulling, pulling you in a million different directions. So when you're able to create those personal and professional boundaries, number one, it gives you an opportunity to take care of you. I know you've heard the term self care, but it's really a thing. You have to learn to pour into your own cup to make sure that you are okay mentally, to be sure that you show up as your best self. Sometimes I think we suffer from what's called presenteeism, meaning we're at home or we're at work, but we're really not there. And when that happens, especially in the workplace, we start to make mistakes. This is when your infection control breaches happen, or you're not documenting properly. Physically, you're there, but your mind is someplace else. And so, by creating those boundaries, you give yourself an opportunity to really take care of you so that you can show up the way that you need to for others.
Dr. Joy, this has been incredibly helpful and informative, and we appreciate you again coming here and doing this session for us. So give us a little tease. We're excited about your webinar, which will be available to our providers. Can you give us a little tease as we try to wrap up this session on what that's going to entail?
It really entails just me taking a deep dive into the different forms of mental health. I use some really cool analogies on how you should be taking care of yourself. I think the most interesting thing for me is how mental illnesses are classified. What I often get is that people try to diagnose themselves. If I'm delivering a mental health course in the audience, or people who may be watching something similar online, they start to say, oh gosh, that could be me if I don't take the proactive or preventative steps to take care of myself. So I think that, and there's something special for healthcare providers, specifically dentists, which I really love. I just think it's a great way for us to see how can we stay on the mental health end of the continuum. The crisis end, right? It starts with being healthy to crisis. And what you're going to find is that there are little things that typically tip people over. Nobody just wakes up suddenly one day and say, hey, I want to commit suicide. There's a series of events that occurs along the way. And I think that people will find, what I will share throughout the presentation is that these are things that I can do so that I don't hit that tipping point.
Thank you again, and you've given us some great food for thought, and certainly the pandemic is causing everyone to rethink how we approach mental health. But an outstanding job again. Thank you so much.
Thank you so much for having me. It's a pleasure.
And for our providers or anyone who is facing mental health challenges, first, we want you to know that we support you. I hope many of you will check out Dr. Joy's upcoming webinar on mental health. It's sure to be an incredible resource if this conversation and Dr. Joy's previous webinars are any indication. Thank you again for joining us, and we look forward to talking more about this important topic. Our door is always open.